The 76-page report from New York's Attorney General tried to answer a question posed to the health commissioner last August during state hearings about the true number of nursing home COVID deaths.
8,000, 10,000, 15,000?
I'm not prepared to give you a specific number.
The official numbers in August were just over 6,000. But the Attorney General's report concluded a larger number of nursing home residents died from COVID-19 than New York State Department of Health data reflected, undercounted by 50% in some instances.
I just heard it this morning, Mary. I'm not even surprised.
Michael Arcuri sounded alarm bells about his mother Louise's COVID death in April. Louise slipped into a coma at Central Island Nursing Home 5 days after a state mandate allowed hospitalized patients back into nursing facilities after they'd been treated for COVID. Louise Arcuri died across the street at Plainview Hospital, and the death certificate didn't reflect where she got sick.
I think it's line 4G. It doesn't have where she was transported from. She got sick in the nursing home.
Michael Arcuri fought to get line 4G filled in, and it was. The AG's report was another blow to the Cuomo administration, which knew from the beginning of the COVID crisis that nursing homes would be vulnerable.
It just takes one staff member who didn't have a temperature but did have the virus to walk in.
Yet the AG's report also criticized some of the for-profit nursing homes for squelching on personal protective equipment.
This is the cheap stuff.
Attorney General James tweeted, insufficient PPE and testing for our nursing home staff put residents and staff at increased risk. Her report had looked at a sample 62 of the state's roughly 600 nursing homes. Health Commissioner Howard Zucker responded much later. DOH has consistently made clear that our numbers are reported based on the place of death. Mayor de Blasio had this reaction.
We have to make sense of this. We have to get the full truth, and we have to be honest about the numbers.
The Attorney General said she's continuing in-depth investigations at 20-plus nursing homes amid allegations of abuse and neglect of COVID-19 patients. Pix 11 had received information last year during our own investigation from a certified nursing assistant who said she was traumatized after seeing other employees simply close the door on sick patients. Michael Arcuri was able to say goodbye to his dying mother, putting on PPE to visit her one last time.
It was hard. Probably the hardest thing I ever do in my life is going to that ward. It changed me. It changed me a lot.
I'm Mary Murphy, Pix 11 News.